Good morning, PSC members and panelists. My name is Felicia Wharton, and I serve as the treasurer of the PSC. And I want to welcome you to the PSC Fall Retirement Webinar, which is a very excellent resource to help you prepare for this important transition, which is called retirement. Now, if there's one thing you should not procrastinate about, it is planning for retirement. Retirement means life without work, but with financial stability. And our union has won through advocacy and tireless fighting for equity and fair pay. Our union has negotiated pension plans into contracts to ensure that our members can support themselves in retirement. For us, that could be found in Article 27 of the retirement for our retirement and Article 26 on welfare benefits. As members of the PSC, we are afforded healthcare, insurance, benefits, pension, because our union fought for them, maintained them, and continued pushing for improvement to our benefits through contract negotiations, both for active members and retirees. When you decide to retire, these protections will be there for you. Therefore, I would urge you to continue your membership and join the PSC Retirees chapter and be a PSC for life. And Bonnie will talk more about that. Let me just give you an overview of today's agenda. Sandra from the Welfare Fund will start us off with thinking about retirement, which is very important. Talin from CUNY Employment Benefits Office will guide you through retiring from CUNY, the nuts and bolts. Michael from the Welfare Fund will provide a wealth of information on retiree welfare fund benefits. Michelle from NYSUT will provide information on NYSUT member benefits. And Bonnie from the Retirees chapter, she is the secretary. She's going to give you a wealth of knowledge about the retiree chapter, which is active and vibrant. And I hope that you will remain a union member by joining them when the time comes. And a little bit of housekeeping before we begin. If you have any questions during the presentation, there's a Q&A feature at the bottom of your Zoom screen. Simply type your questions there and one of our panelists will address them after their segment. Again, thank you for being here today. And I'm not going to keep you any longer because I know you're waiting for all the panelists to begin. So let's begin. I'm going to hand it over to Sandra.
Good morning. When we're talking about retirement, thinking about retirement, the process can be an overwhelming one. You need to begin to do your homework with plenty of time, more than a year or two before you even think of beginning your leaves to then retire. And you need to do your research. It's not a one-stop process. You know, you're not talking to just one person that's going to handle everything for you. There are different people with various expertise that you will need to contact on your path to this goal. There are two major components to planning retirement. One, the major one is the financial aspect of retirement, which is I'm not getting my paycheck anymore. Where is the money going to come to allow me to walk away from my job? And the other major component is, are you retiring with benefits from CUNY? So let's talk about the financial component. In general, income replacement for retirement from all sources should be around 70% from all sources that are going to replace your income. But in reality, retirement is all about meeting your budgetary needs. What is it that you need to come in money-wise to pay all your bills, incorporate travel, entertainment, everything into your budget. And when you look at the sources, a lot of people focus on just what's coming from the retirement system through their employer, whether you have TIAA, TRS, NYSERS. That is not going to be sufficient for a lot of people that want to retire before Social Security comes in. It is important to take into consideration that Social Security at the full retirement age for someone, you may be getting roughly 30 to 40% income replacement just from Social Security. So what are the other sources? Your pension system, your TI retirement, optional retirement plan and savings, TDA savings, tax deferred savings, deferred compensation savings, all those pots of savings come in and help you cross that bridge into retirement. If you were born in 1964, you turn 62 in 2026. And your full retirement age with Social Security will be age 67. So if you haven't created access to Social Security, you should be creating a username, password. You have a one-time code every time you log in that is sent to you. And you should be going in there and verifying that your work history and your W-2 information is correct. Also, that you see what you're going to get if you decide to retire early, if you go to your full retirement age, or are you waiting until age 70? It's important that you know what's coming from Social Security so that you could plan better in terms of what is the part that's coming from your retirement system, TIAA, TRS, or NYSERS. It's also important to note that the other component of retirement is, are you walking away with the benefits? What are the benefits? Health, welfare fund benefits, which you get from the welfare fund, dental, vision, hearing aid, prescription drugs, and my colleague Michael Foley will be talking in detail about that. Talin Spenjian, who will be speaking after me, will go in depth about retirement and all the details about leaves and everything from CUNY. This is just an overall guidance on what it is that you need to look for when you are retiring. So if you are looking for walking away with the benefits from CUNY, part of those benefits is that once you are 65 and older, you will have to be on Medicare, paying Medicare Part B premiums, but you will be reimbursed for those Medicare Part B premiums through retirement until your death. So that's crucial because with Medicare Part B, that's going to be $206.50 monthly for the standard Medicare Part B premium beginning in January. And if your income or how you file your for taxes puts you over the standard limits, there's thresholds, you will be paying more, and that's called income-related monthly adjusted amount. What's important for you to know, as a CUNY PSC retiree, if you walk away with these retiree benefits from CUNY and the city, you are going to be reimbursed for whatever Medicare Part B, as in boy, premiums are through your retirement. So here on the screen, I'm not gonna just list what you're seeing on the screen, but whatever pertains to you as a member of the system that you're seeing here, you're seeing what the criteria is that you need to meet based on your retirement system to walk away with health, welfare fund benefits, prescription drugs, and Medicare Part B reimbursements for you and your dependent spouse and or child if they are disabled. Talin will speak more about that. But what's important to note here is that you will be going through a process with human resources where you're going to discuss your eligibility for these benefits and knowing how that comes into play when you start retirement. Retirement normally starts with Travia leave or just leaves in general, depending on your title. Talin Spenjian is going to talk more about those in detail. So please hold your questions after she does her part. What's important here is to know who do you contact when you begin your process of reviewing if this is all doable. Am I going to retire? I'm going to start my pre-retirement meetings. TIA members, you're going to meet with your advisor if you have one assigned. If not, you're calling TIAA and scheduling a meeting with one of their consultants. You are going to discuss if you're on track to meet your income and goals for retirement, and you will discuss if you are going to have these retiree benefits when you walk away from CUNY. TRS members, this also applies to NYSUT members and PSC titles. You're going to look at your annual benefit statements, and what's crucial here is that if you look at an annual benefit statement, you're only going to see data once you are a year away from age 55, that being estimates, pension estimates. You're not going to see that if you're in your 40s or early 50s. Not going to happen. And if you are retirement age, 55 and older, and you still are not seeing estimates in the annual benefit statement, that's because your service is not up to date with TRS. The flow of information from CUNY to TRS, it's all manual. And therefore, that prompts you to request a service record update from HR to be sent to TRS and also get a copy for your records. If you are with TRS, you will probably enroll in the TRS retirement class to understand how your pension tier works. You will be meeting with me when you are getting close to retirement for either a pre-retirement counseling meeting or once you're officially retiring within 3 months of the official retirement date. When you meet with me, your service should be up to date, FYI. So the process, once you do decide to retire, and again, Talin's gonna speak more in detail about this, but overall, the process starts with HR. You're going to coordinate what it is, the date that you want to retire. If you are in a title that has Travia leave, you're going to obtain that form from HR, have it signed by your chair and return it to HR. Before you go on leaves, you're going to be having a meeting with HR. Usually this happens actually when you are on leaves, to discuss the retiree benefits forms that you should be completing and returning back to that office. You should go to Social Security at least 3 months before your official retirement date and apply for Medicare Part B. A big important note here, for example, if you retire in January 26th of 2026, your application for Medicare Part B should be for it to start on January 1st, not February 1st. TI members, TRS members, you know that TIA, you meet with your advisor or consultant. TRS, you meet with me. And NYSUT members, you meet with a counselor and NYSUT at least 3 months before your official retirement date. You received folders with a lot of resources. Some of them were put together by me, and others were provided by PSC, by the union. Please refer to those resources. Very important. And most importantly, if you have any questions, retirement specific questions, please contact your retirement system. If you are with TRS, you could, email me and I'll intervene and, help you get to where you need to be by the time you transition into retirement. Now, I'll hand it over to Talin Spenjian, who is going to discuss the nuts and bolts of retiring from CUNY. And then put your questions in the Q&A after her presentation, and we'll be answering those questions as they come through, and for everybody to be able to see the answer to the questions.
Thank you, Sandra. Thank you, PSC, for inviting me. My name is Talin Spenjian. I'm the Director of Benefits in the University Benefits Office. I will proceed as soon as I start to share my slides. If you could bear with me for 1 second. Oops. Sorry. Can everyone see that?
Yep, looks good.
Okay. Let me just make it bigger. How's that? Okay. So, this is my email address for anyone who would like to reach out to me. I just want to say, this is a presentation that's intended to be general in scope, and I can answer general questions that everyone else will benefit from. But if you have very particular questions about your particular circumstances, I don't want to get into a lot of personal conversations with you, on this at this event. You're free to email me and I will answer all your personal questions as needed. But this is really not the forum to go into your particular circumstances in detail. So I thank you in advance for understanding that. These are the topics that I'm going to go over today. As I said, it's going to be a very broad-based overview of these topics, but they are important. And something that I recommend you do is to attend this seminar multiple times. I will also be holding a similar seminar in the spring, and you should attend more than just one of these because there is a lot of information. So the eligibility for retiree health benefits comes directly from the PSC contract, and it's based on your date of hire, your years of service, and your age. But for most people on this call, this is the section of the contract that probably pertains to you because it's based on anyone hired after, oh, here it is, after September 1, 1985, which probably accounts for most of you on this call. So if you're in TIAA, you have 15 years of continuous full-time service and you reach the age of 62, you're eligible for retiree health benefits. There's caveats if you leave CUNY with 15 years, but you don't have the age. You can come back when you turn 62 and get your health benefit, your retiree health benefits, but it depends on where you've worked. So if you leave CUNY with 15 years and you're not yet 62 and you go to work for another institution of higher education, you could disqualify yourself from coming back when you reach age 62 to claim your retiree health benefits. So where you go after you leave CUNY matters. If you are in TRS, NYSERS, or Board of Ed, you need 10 years of credited service and are eligible to receive a pension in order to be eligible for retiree health benefits. A few years ago, the years of service requirement was reduced to 5 years for receiving a pension if you're in TRS or NYSERS, but the Office of Labor Relations in New York City that manages the retiree health benefit still requires you to have 10 years of service to be eligible for retiree health. So even if you're eligible for a pension with 5 years of service, you still need 10 years to get retiree health benefits. This is a recommended timeline of actions that you need to take. If to verify your years of service, you should do that now. It says 4 years or 6 to 12 months prior to retirement, and that's because if you're going to go on phased retirement, that's a 4-year process, and that's why it says 4 years there. But verification of service is important, and I'm going to go into why that is. Phased retirement is 4 years prior to retirement. There's a Travia leave form that you need to, if you want to go on Travia leave, you should do that about 4 months before the start of Travia. Contact your pension system at least 5 months prior to retirement, and maybe even earlier. You know, these are just recommended. You may have a complicated situation where you need to contact them earlier if there's a disagreement about when you joined their pension system. And so that is a piece of information that drives everything. And so you should make sure that, you know, all the records are in line. And then we're going to talk about applying for Medicare Part A, Part B. You should contact your HR 2 months prior to retirement to receive all the documents that you need from them. And also, if you are participating in a NYSUT plan, you should contact NYSUT also to understand what is required of you to maintain the plans that you're in after you leave CUNY, after you retire. So verification of service is very important because what did I do? Oh, what did I do? No, that's not it. That's not it. There I go. Sorry. I don't know what I did. Okay, verification of service is really important, as I said, because your date of service drives all your benefits. So sometimes CUNY, PSC members come to CUNY and start to teach as an adjunct before they get a full-time appointment. And so they think that that is their original hire date. And for the purpose of pension and retirement, it's not. So you don't get service credit for the time that you worked as an adjunct if that precedes you getting a full-time appointment. So you should make sure that your understanding of your hire date and the date that you joined your pension system is consistent across the board, so that if there are any errors, you have time to rectify them. And you know, you want everybody to be on the same page so that there's no confusion about what you're eligible for, because your hire date drives everything. If you've worked at multiple campuses, sometimes the campuses can't see your services. So if you worked a few years at Baruch and then you went to Hunter for the next 20 years, you know, Hunter is not aware of your Baruch appointments. So, you know, all of that should be coordinated so that the correct service is reported to the pension system for calculating your pension and your eligibility. This is also a really good time to ensure that your Social Security records are accurate. So look at log on to the Social Security Administration, SSA.gov, look at your work history, make sure that all the years of that you've worked in the United States are accounted for. You know, even if you have to go back to when you worked, you know, like I did at a fast food restaurant when I was 15 years old. So make sure that all of that, all of your work history is accounted for, because if there are any errors that need to be corrected, now is the time to contact them and try to figure out how to have those records corrected so that you get credit for all your years of service. So one of the benefits for TIAA participants and is phased retirement, and this is exactly what it sounds like. It allows you to phase into retirement by working a reduced workload for either 1, 2, or 3 years, so that you can adjust to retirement by working less and then transitioning to full-time retirement. So this is only available to TIAA participants. You have to have 15 years of continuous credited full-time service, and you have to be age 65. So the way it works is you decide if you want to phase for 1 year, 2 years, or 3 years. And what happens, it always has to start on the first day of a fall semester, so it's consistent with the academic year. And your workload is reduced to 50%, and your salary is reduced to 50%. So you can do this for 1, 2, or 3 years. If you decide to take Travia, which I'm going to talk about in a second, you can take Travia in the final semester during your phasing period, and that satisfies the phasing requirement of 1, 2, or 3 years, and it also reverts back to full-time salary. So even if you're on a 50% salary, during Travia, you go back to 100% salary. And the combination of phasing and Travia cannot exceed 3 years. So if you're going to phase, Travia has to be part of that 3-year calculation. A lot of people are reluctant to go on phased retirement because it's an irrevocable decision. So once all the documents are signed and approved and you go on Travia, you can't decide to come back to work. That's not the case. I mean, phased retirement, I'm sorry. That's not the case with Travia leave. You can go on Travia leave and then rescind your retirement and come back to work. It's not advisable, but people do that all the time. With phased retirement, that's not possible. So even if you're taking Travia in the last semester of phased retirement, it is irrevocable. You cannot rescind your decision, and you have to retire at the end of Travia. So it is recommended that applications for phased retirement be submitted at least in November of the prior year in which you expect to go on phased retirement. So November 15, if you wanted to go on phased retirement fall of 2026, you should have submitted your phased retirement application November 15 of this year, which just passed. One of the things that is allowed that I've seen, sometimes employees think that they apply to go on phased retirement for 3 years, and a year into it, they realize that, you know, they're really anxious to retire and they don't want this arrangement anymore, and they make the decision to retire fully. So you would that requires a settlement agreement because it's in conflict with the irrevocable nature of the phased retirement form. And so if you want to, you can't increase the years of phased retirement. For example, if you decide to go on, if you want to phase for 1 year, you can't come back and say, I want to phase for 2 years. But if you apply to phase for 3 years, you can come back and say, you know what, I changed my mind. I want to, as soon as this first year is up, I want to retire fully. You can do that with a settlement agreement, and that has to be coordinated with the labor office. Phased retirement is also available to HEO titles, but it's slightly different. For HEOs, the requirement is still the same. You have to be in TIAA, you have to have 15 years of service and be age 65. But unlike teaching staff, the workload is reduced to 80% and the salary is reduced to 80%, and you can phase for either 6 months or 1 year. And it says that it should be the beginning of the fall semester, but HEO appointments are not like academic appointments. So there's a little more flexibility with when you want to go on phase retirement for HEOs, but you still need to give your department, a lot of advance notice. So a year before you plan to go on phase retirement, you should notify your department and apply for it. And but again, it's only for either 6 months or 1 year. But if you decide to go on phase retirement for a year, you can still take Travia in that second half of the last 5 months of your phasing as a HEO can be Travia leave. And then again, it will revert back to 100% salary. So there's a lot of talk about Travia leave. So let's get into the nitty gritty of Travia leave. Travia leave allows you to get your half of your unused sick leave paid out. And in order for that to be the case, you have to have 160 days of sick leave. Which is the maximum for most employees. If you have 160 days of sick leave, you can get paid out half of that, which is 80 days. If you are at the max, the 80 days is a little short of a full semester, but if you have the maximum, we roll you up to the full semester. So if you have 160 days, you can take an entire semester of Travia leave, be paid 100% of your salary for the entire semester. If you have less than 160 days, then the calculation is precisely half of whatever you have. So if you have 100 days, you get paid out 50 days, not the full semester. It's not rounded up. If you take Travia leave in the spring, which is when most people take it, they work in the fall semester, they take Travia leave in the spring, you get the summer is considered annual leave, and then your retirement date will be that last day before the fall semester. So that'll be your actual retirement date somewhere around August 26 or 27, whatever day that falls on for that particular year. If you take Travia leave in the fall, which most people do not do, if you take Travia leave in the fall, you're not eligible for subsequent annual leave in the following summer. So your Travia leave ends that last day in January before the first day of the spring semester, and that's your retirement date, and that's when you separate from CUNY. If you're participating in the dedicated sick leave, donating unused sick leave to coworkers, or you participate in the catastrophic sick leave bank programs, you should think about that when it comes to being eligible for Travia leave, because if you're using up your sick leave for other purposes and you fall short of the 160 days, you may be working against your own interest by reducing the number of days you can be paid fully during Travia leave. So you don't want to fall short of the 160 days if you're close to it because you've been donating to other programs. So that's just something to consider. I'm not saying you shouldn't do that. It's very generous of you to do that, but it could adversely affect you. The other thing that you should do regarding review your transit benefit, which I'm going to talk about in a second, because if you're on Travia leave and you're not working anymore, you should reconsider the money that you're contributing to your transit account. Because if you're not traveling, you're not commuting, you may end up accumulating money there that you're not going to be able to get back. And I'm going to talk about that in a second. So that is something you should, contact Edenred or create an account online and look at what your balance is and coordinate a spend down strategy with your HR, your benefits officer at your campus, so that you don't over accumulate money in your transit account. And I'm going to talk about that in a second. This I already talked about. This is a question that just came up in the chat. During Travia, there's a limit on how much you can work. So if you're instructional staff, you can only teach 3 credits while on Travia. That's the limit. If you're a non-teaching adjunct or non-teaching staff in any title, in any PSC title, you can work up to 75 hours in the entire semester. So that's your limitation of working while on Travia. There's an annual leave cap. Annual leave is generally paid out in a lump sum for not faculty, but for HEOs. And there's a cap on how much can be paid out in a lump sum. So if you're an ECP and you have over 50 days, you should consider spending that down. If you're a HEO, the cap is 45 days. You should consider spending that down. So when the time comes to have your annual leave paid out, you don't lose money because you've exceeded the annual leave cap for lump sum payouts. Faculty who are on fellowship leave are required to be back at work for 1 full year before they're allowed to retire. I get lots of questions about this, all different scenarios. It's 1 year to return. However, the one caveat, the one exception is if you come back to work from fellowship leave, you can come back to work for 1 semester and then go out on Travia in the 2nd semester of that academic year. And that Travia semester will count as part of the 1 year back to work requirement. So I hope that's clear. It's kind of confusing, but Travia counts as part of the 1 year return to work requirement for those on fellowship leave. Okay. So one of the most confusing parts of retiree health is how it's coordinated with Medicare. And so I constructed this chart, and I'm going to walk through a couple of scenarios with you to show you how the chart is read and interpreted so that you can answer some of your own questions about this, or if you don't recall the answer, you can go refer to this and have a sense of what the requirements are and how these are coordinated. So so the way to read this is, this chart is for active employees. So in the first column, it says under 65. So if you're an active employee under 65, what do? You remain in the city, in the health plan that you're in as an active employee, and Medicare Part A and B don't apply because you are not 65 yet. So if you're an active employee and you're over 65, we go to the third column, and even though you're over 65, you're still actively working, so you remain in the city health plan. You can enroll in Medicare Part A within 3 months of turning 65. There's no cost and there's no downside to it. Medicare Part B, you should not enroll in because you're still actively working. It's not required. There's a cost associated with it that is going to be an out-of-pocket expense for you. And because you have a rich health plan with your employer, with CUNY, having Medicare Part B will not give you additional coverage. So because you're in an employer plan, there's no penalty for enrolling late in Medicare Part B. That is your exemption. So you do not enroll in Part B. If you are the spouse of an active employee, so let's go to the second row. If you are the spouse of an active employee and you're under 65, You also remain in the city health plan. Medicare Part A and B are not applicable because you're under 65. If you're the spouse of an active employee and you're over 65, again, you remain in the city health plan because your spouse, who is an active CUNY employee, is covered, and therefore you are covered, and you do not need to enroll in Part B. You can enroll in Part A if you choose to, but you do not have to enroll in Part B. I'm gonna stop sharing this for 1 second because I want to go to the Medicare grid that I believe it's this. I'm hoping it's that. Yes. All right. So this is the grid. Oh no, it's not. I'm sorry. Let me try that again. Okay, here we go. So this is no, I did that wrong again. Bear with me 1 second while I figure this out. Okay. Um, okay. I think I got it. Okay, got it. Sorry about that. Okay. So, so those are the first two rows that we went over. Now I'm going to go over one about a retiree. So let's talk about the hardest one, which is the last, this one, under 65. You are a retiree and you're under 65. So in the first column, you are enrolled in a city health plan. Medicare Part A and B is not applicable because even though you're retired from CUNY, you're still under age 65. So if you're a retiree and you're over age 65, these are all the things you have to start doing. And that's when things really start getting hectic. So you are enrolled you have to be enrolled in a senior care plan because the senior care plan is similar to the active plan, except that it's coordinated with Medicare. So behind the scenes, Medicare becomes your primary coverage. The senior care plan functions as a supplemental plan. So if you are retired and you're over age 65, now you have to enroll in Medicare Part A within 3 months of turning 65. You have to enroll in Medicare Part B when you're either retired or turned age 65, whichever comes later. The effective date of Part B should be the day of the month in which you retire or turn 65. So if you're retiring, like many instructional staff do, on August 26th, you should enroll in Medicare Part B and A if you haven't done it already on August 1. So not September 1, August 1. So the first day of the month in which you retire or turn 65. Medicare Part D, which is a drug plan, is not applicable, and Michael is going to talk to you about that because your drug plan is provided for you by the PSC Welfare Fund. So Michael's going to talk about that, so I won't bother. And then you should also apply for Medicare Part B reimbursement and IRMA reimbursement if that applies to you. So these are all the things you have to do once you're retired and over 65. There's one caveat to this. Excuse me. If you have a domestic partner on your health plan as a retiree, and that domestic partner turns 65, they have to enroll in Medicare Part B. They do not have the same exemption as legally married spouses do, because the federal government doesn't recognize domestic partnerships. So if you're under age 65 and you're still working and you have a domestic partner on your plan and they turn 65, they have to enroll in Medicare Part B. If they do not enroll in Medicare, they will be subject to a late enrollment penalty for life that never goes away. And the longer they wait to enroll in it, the penalties add up. So if you have a domestic partner, once they turn 65, they have to enroll in Medicare Part A and B, even if they're still on your active health plan. Okay, so I'm going to stop sharing this and go back to my original oops, my original slides. I Okay. So I hope I helped explain some of the confusion about coordinating Medicare Part A and B. Another thing that I wanted to talk about is the new New York City Health Plan PPO that is replacing the GHI CBP plan. If you For retirees over 65, nothing is changing. That plan does not affect you in any way. This plan, this New York City, this new NYCE PPO plan is for active employees and retirees under age 65. Because if you're under age 65, even if you retire from CUNY, you still remain on the same active plan as active employees. You're not on the senior care plan until you turn 65. So this is going to affect you. And on January 1, everyone who's in the GHI CBP plan, unless they actively enroll in an alternate plan, everybody's being transitioned to this new plan on January 1. The primary difference between the GHI CBP plan and the NYCE PPO plan is that the hospitalization part that used to be covered by Anthem, Blue Cross Blue Shield, is now going to be provided by United Healthcare. So the hospital part of it is not as consequential, I don't think, because most plans cover most hospitals. So whatever hospitals you use in your area, I'm confident that United Healthcare is going to cover them. The hospital part of it is not the biggest deal. So in that respect, I don't expect there to be any change. The major change is that the GHI participating network of physicians is only applicable to 13 of the downstate counties in New York, lower New York. So that includes, Manhattan, the 5 boroughs. It includes Long Island. It includes, Orange County, Westchester County, Rockland County, and maybe a couple others. I don't know all of them off the top of my head, but there is a map that you can look at. But if you're in the New York area, you're still going to be covered by the GHI physician network. If you live outside of those counties, so if you live in New Jersey, Connecticut, and even further of the more northern counties of New York State, you're going to be covered, and the rest of the country. So anywhere outside of those 13 downstate counties, the remaining part of the country is going to be covered by United Healthcare Network of Physicians. And so there are links now. There's a dedicated website, and there are links to search your doctors. So you can go in and search your doctors to see if they're covered in the United Healthcare Network. I live in New Jersey. My doctors are still in the United Healthcare Network that I used, who were also in the GHI network. So, I'm hoping that the disruption is not a big one for most of us, but the link for checking your doctors to see if they're in the United Healthcare Network are there, and this is the opportunity during open enrollment now for the month of November, that if you find that the doctors that you use are not in the United Healthcare Network, and you don't want to change your doctors, this is the time to consider alternate plans, if you would like to keep your doctors. So it's going to require a little bit of homework on your part, because if you don't do anything, you're going to be transitioned to the new plan on January 1. The Office of Labor Relations allows you to change your health plan once a year during open enrollment. So even if you're retired and you're on a retiree plan and you find that it's not working for you during open enrollment, you have the opportunity of changing that plan. They used to only allow that every other year, and now they allow it every year. What happens when you, as a CUNY retiree, you pass away? Are your dependents eligible for your health plan? Unfortunately, they are not. They will lose coverage. If you pass away, they can keep the coverage through COBRA for up to 36 months, but that means they'll be paying the full cost of it, not just the small employee contribution that we're accustomed to. And for the welfare fund benefits, Michael will talk about, but the PSC welfare fund does extend full benefits to surviving spouses of CUNY deceased retirees. So Michael will talk about that. Right, Michael? Yes. Okay. Michael will talk about it. All right. So as I said, the GHI Senior Care Plan is still in place. The GHI Senior Care Plan has a very unique coordination with Medicare, in that when you're retired and you're enrolled in Medicare and you go to a Medicare doctor, Medicare is going to pay 80% of your claims, and the GHI Senior Care Plan is coordinated behind the scenes. They will pick up the additional 20%. This doesn't exist with any of the other plans. This is unique to the GHI Senior Care Plan. So it really gives you the most bang for your buck. You don't have to go to a GHI network participating doctor. You can go to any doctor that takes Medicare, and this arrangement will apply. So you can live anywhere in the country. As long as you go to a Medicare doctor, this 80-20 arrangement will apply, regardless of where you live. You don't have to go to a GHI network participating physician in order to have this play out in this way. So we were talking about Medicare Part B reimbursement. As a CUNY retiree, the cost of Medicare is reimbursable to you. So currently it's somewhere around $200 a month per person. So it's, $200 for you, $200 for your spouse, if your spouse is also 65 and covered under your retiree health plan. Medicare Part B costs are reimbursable to you as part of your retiree benefit. If you are in TRS, NYSUT, or the Board of Ed, this is the link where you will submit forms, where you can find forms, and then with instructions on how to submit forms to set up that Medicare Part B reimbursement. You only have to do it once, and every year you will automatically get the reimbursement in April for both you and your spouse. So for NYSUT, TRS, and Board of Ed retirees, that reimbursement will be deposited into whatever bank account your pension check is being deposited. That's not the case for TIAA. It's a little more complicated. So if you're in TIAA, there's someone in my office that manages the reimbursement. The forms you can still get from the OLR website, or you can actually, no, you'll get it from us. You would send that form in to this email address, and someone in my office will manage, set up that reimbursement for you. Again, you apply for it once for the basic premium, you apply for it once, and then you'll automatically get it every year. For TIAA participants, that means you're going to get a check in the mail. We don't have that luxury of having it direct deposited. That option is not available to TIAA retirees at this time. But the additional IRMA premium is also reimbursable to you. So the IRMA premium is income related. This was instituted a number of years ago. There's a sliding scale depending on your taxable earnings, whether it's an individual taxable earnings or joint tax filings with the IRS. It's based on that income. You may be responsible for higher premiums because of your income level. As your retiree benefit, you're eligible to be reimbursed for the IRMA premiums as well as the basic, but the process to apply for it is a little bit different. So with the basic, you apply for it once and you automatically get it every year. With the IRMA, because it's income related and because your income can change from year to year, it's not definite that you will always be charged the IRMA premiums. So every year that you are charged the IRMA premiums, you have to apply for the reimbursement. So you have to apply for it on an annual basis. You have to submit the supporting documents. The instructions are on the form that you download from the OLR website. And then that reimbursement will be sent to you later in the year, in the month of October, most times. Again, for TIAA participants, that IRMA reimbursement is in the form of a check mailed to your home. For NYSUT's TRS and Board of Ed retirees, that check, the IRMA check, will be deposited into your bank account where your pension check goes. This is just more reiteration of what I already said. You can apply for Social Security and Medicare online. When you retire, Medicare becomes primary and your city coverage is secondary, or essentially a supplemental plan. So let me just say, you know, when you approach age 65, you're going to be bombarded with mail from Medicare Advantage plans, private plans. Please don't enroll in them. Please just put them in the garbage. You have a very rich retiree health plan with this senior care and the Medicare coordination. You do not have to enroll in a Medicare Advantage plan. Please just put all that mail in the garbage and don't look at it. As I said earlier about the transit benefit, once you retire, you only have 90 days to use whatever remaining balance you have in that Eden-Red account. I just got a call from a retiree who retired a year ago, and he asked me, how do I get my $1,700 back that's in my Eden-Red account? $1,700. And my answer was, you can't, because these pre-tax benefits are governed by the IRS. And because they're pre-tax, there are very rigid rules around it. So once you retire, you only have 90 days to spend down that money. And spending it down doesn't mean getting reimbursed to you. Spending it down means buying subway tickets, bus tickets, Metro North tickets, commuter benefit tickets. The only way to use that money is to purchase commuter benefits. MTA cards, whatever the case is. And one of the things that was a consequence of working remotely 100% during the COVID shutdown is that people stopped commuting to work. And so they weren't buying transit tickets, bus tickets, whatever it was, train tickets. And money accumulated there because a lot of people didn't realize that they could have reduced the amount of money. It's one of those autopilot situations that money is being deducted from your check, going into a transit account, and you don't even realize it. And all of a sudden, if you're not paying attention, you've accumulated a massive amount of money. And now you're looking at retirement. There's no amount of time that you don't have sufficient amount of time to spend that down again. In addition, if you're over 65 and you're eligible for a discounted rate for public transportation, again, you're not using as much as you used to. You're not spending as much as you used to spend, but your contributions continue to accumulate in your transit account. So please look at your transit account now. You can, if you've got an accumulation there that you don't think you're ever going to be able to spend down, go to your HR office and reduce the contribution to $1. That way you stay in the plan, you're contributing a minimal amount of money to stay in the plan, and you can spend down that money over the next, months or years, without it continuing to accumulate. So go onto your Eat and Red account, look at what your balance is, and come up with a strategy to reduce that, to spend down that money. Because once you get past 90 days from your retirement date, you will lose whatever is there that you haven't spent, and you don't want to lose money on this. So if you're, for example, just as a reminder, if you're on Travia leave, you're still collecting your full salary. So you're still considered active. And then during the summer, when you're getting paid annual leave, you're also considered active. So that time is not counted toward those 90 days. That 90-day clock starts at the end of August, when your Travia leave is ended, your annual leave is ended, and now you're considered fully retired and you're no longer collecting a paycheck. That's when that 90-day clock starts. The same applies to the healthcare flex spending account. If you're participating in the FSA, you have to spend that money down. Again, you only have 90 days from when you retire, from your retirement date, to use this money. So rethink how much you're contributing to this and make sure that you have enough time to spend down these funds. Because again, at the end of the year, whatever is not spent or exhausted, you're going to lose. Okay. The deferred compensation plan is an additional investment option for you as an active employee. And the great thing about this DC plan is that it's like a tax deferred annuity that you have as either a TIA participant or a TRS participant, but this allows you to double the maximum that you put into a tax deferred annuity. So if you are in TRS and you're contributing to the TDA, or if you're in TIAA and you're contributing to the TDA and you're maxing out, so you're contributing the maximum that the law allows you, you can also participate in this plan and max out on this plan as well. So effectively, you're doubling the pre-tax earnings that you're putting away into retirement for yourself. So the limits on these two plans are not coordinated. You can contribute the max in both plans. And the reason why I'm bringing this up now is that if you are not familiar with this plan and you're still a year or 2 or 3 away from retirement, this is a really great opportunity for you to sock away more pre-tax money if you can afford it, and effectively double your pre-tax contributions to an investment plan that you could benefit from. The one thing that I need to remind you is that the withdrawal options for this plan are a little different from the TIAA or TRS TDA. So you should talk to a counselor at this, at this in the DC, in the 457 plan. You should talk to somebody to understand what those rules are for withdrawal, and so that you go into it, as an educated investor. But this is a really good time for you to consider this plan, even if you're close to retirement, a year or two away. If you participate, when I do my pre-retirement seminars in the spring, I always invite someone from the 457 plan. So if you attend one of those, you'll be able to ask questions directly to the presenter, and you can also contact them or contact your benefits officer and find out who the rep is for your campus. They usually assign them by boroughs, so you can find out who that person is for your campus and contact them and get advice about that. It's really in your interest to do that. Retirement counseling, Sandra already went over this. You should contact your pension system as early as possible. Talk to them, get advice about what your options are, so that you go into it, fully educated, and you can get this information from your benefits officer at your campus. I wanted to say that your first point of contact should always be your benefits officer at your campus. I am available to assist you in complicated situations. Sometimes the benefits officers reach out to me when it's extraordinarily complicated. They are generalists, so they have an enormous array of things that they're managing at the campus level. It's impossible, unless they've been working at CUNY for 30 years, to know the nitty-gritty details of every single scenario. And so, but they should be your first point of contact, and anything that's extraordinarily complicated that they need guidance on, they'll contact me. You can contact me also, but your first point should always be your HR office. Working after retirement, a lot of people like to do this. There are limitations. If you retire and you're under age 65, there are limitations. If you are in TRS or one of the public pension systems, there's an earnings limit that's 35,000. It was 35,000 in 24, and it's still 35,000 now. You can't earn more than 35,000 a year if you're under age 65 and you're collecting a pension from a public system. If you're over age 65, there's no limit. If you work for the private sector, there's no limit. The only time this limit applies is if you are under 65 and you're collecting a pension from a public pension system in New York, either New York State or New York City public pension system. Don't forget, after retiring, to keep your change of address updated with all the different entities that you're affiliated with, whether it's our office, whether it's the welfare fund, PSC, even your campus. It's important that we are able to contact you if necessary. If you change your bank accounts, don't forget that your pension check is being directly deposited into a bank account. You don't want a disruption in that. So make sure that you update your pension system with any banking changes, your contact information, your telephone number, email address. All of these things are important, and none of these entities talk to each other. So just because you update your address with PSC doesn't mean that my office is informed of that. They're all separate. So make sure that all of these entities are able to contact you in retirement. And the other thing that I wanted to remind you of is beneficiary changes. We all go through life changes. We become widowed. We get married. We get divorced. Your beneficiaries should always be updated with all these different entities as well. Your marital status affects your retirement, especially if you're with TIAA. So these are all life changes, life event changes that may trigger updating information with all the different entities that are involved in your retirement. These are just some links for you. And now I will stop sharing my screen, and I have 15 minutes to answer questions. I tried to answer some of them when Sandra was speaking, and I hope that I got to all of your questions. I see the number is down to 5, so I'm thinking Sandra's been busy answering questions while I'm speaking. So I'm not sure if the Q&A is the only way to ask a question. Are we allowing members to unmute themselves? I'm not sure.
Yeah, since it's a webinar, I can't unmute folks who are attendees, Talin. So we have to use the Q&A, but
Q&A is the only one. Okay.
yeah,
So,
fortunately, yeah.
okay, so let me go to.
Michael and I have been answering a lot of questions,
great.
and I've been putting your email and phone for those things that I can answer.
Okay.
But let me see if there's anything here that I may ask you live. Hold on.
So I'm seeing something by Kevin. I thought that you would be liable for hospital expense if you don't enroll in Part A if you're over 65. If as long as you're working, you have hospitalization with CUNY. So the Part A, in fact, if you're still working, even though we recommend that you enroll in Part A, you shouldn't even use your Part A card. So if you're hospitalized and you're still actively working and you're on a city health plan, don't even give them your Medicare Part A card because that causes complications. Just give them your GHI or whatever health insurance card you have, because your active health insurance plan is more generous than the Medicare plan. So there isn't going to be anything left over for Medicare to even cover. So the Medicare, even though you're enrolled in it, is not really going to get used until you actually retire. And Medicare becomes your primary plan.
Right. It says, what is the penalty if you're under 65 and you earn more than 35,000?
What is if you're under, the penalty is that they will stop your pension. They will pause your pension check. And that's the consequence of earning more than 35,000. Well, and they'll know that you are because they get payroll records from CUNY, so they know.
Are you reading the GHI?
You can share. Did you share my slides with I'm not sure if they were distributed, but somebody's asking about the links in the last slide. I think you received.
So I've been responding to folks who have this question. The recording for this webinar, the link to that recording, as well as all the materials shared today, are compiled in a folder that are being emailed to folks who were able to join today, as well as folks who couldn't join today early next week. So folks who will have access to all of that as well.
Okay, thanks.
Talin, the question, if active faculty over 65 do not need to sign up for Medicare A, why not?
Because it makes you, it forces you to log in, create an account, and it makes it that much easier to enroll in Part B once you're ready to do that.
And there's a question, if one hasn't applied for Medicare B within 3 months of turning 65, can one yet apply? So it's the B. Be cautious.
The problem with, if you're talking about when you're retired and not applying for Medicare Part B, what happens is you're not in the senior care plan, and you're supposed to be in the senior care plan. Now you don't have Medicare Part B, and it causes a lot of confusion, and it's not the way it was intended. It just creates a lot of chaos. It's really better to do everything when you're supposed to do it, and it leads to less confusion when claims get paid.
What is the best strategy for coordinating your last fellowship leave with phased retirement?
You still have to come back for a year. You know, if you're on fellowship and you come back, I don't really know if you can go on phased retirement immediately after coming back from fellowship. I'm not 100% certain about that.
Someone is asking,
I would have to find out if that's allowed.
if your spouse is working after you retire and uses your health plan as a secondary plan, does he have to file for Medicare B when I do?
If they're over 65 and they're on your retiree health plan, they also have to enroll in Medicare Part B.
Yeah. I have a question about the following. Dependents covered by CUNY retirees health plan will lose coverage upon death of retiree. Am I right in
Yes.
assuming that this doesn't apply to a spouse?
It does
applies.
apply to the spouse.
Right.
You're a dependent. Yeah, it does apply to you.
Okay. I have a question. Can you apply to GHI again if you have a different medical plan in retirement, or is the retirement plan already fixed?
No, the OLR considers retirement a qualifying life event. So even if you're not in the GHI plan, upon retirement, you have the option of enrolling in it.
For domestic partners over 65 with partner over 65 still working, do I need to apply for Part B after travel leave or before? Am I retiring in May 26th? I am retiring in May 26th. He's applying for Travia in the fall 26th, then retiring January 1st, 2027.
All right, I have to read that myself.
Okay, it's in the Q&A, yeah.
So if you're talking about domestic, if you're over 65 and you have a domestic partner who's on your retiree plan, they have to enroll in Medicare Part B also, even if they're working. They don't have to be on your retiree plan. They can be on their own plan and then they don't have to. But if they're on your retiree plan and they're over 65, they have to enroll in Medicare Part B. But it's reimbursable. You know, you're paying for it every month out of pocket, but then the following year you're going to get a lump sum reimbursement. So it's all going to come back to you.
Just there's a couple of questions here about applying for Medicare Part B. Just to re-emphasize, you're only applying for Medicare Part B when you are retiring from CUNY. If you're in a full-time title, or if you're an adjunct that has health coverage through CUNY, not before. Medicare Part A, as Talin mentioned when she was talking about this, you do apply for that at 65, that's free, and that you apply for that regardless of employment. But Medicare Part B is only when you are retiring, correct? Talin?
Mm-hmm. Yes.
Okay. Could you briefly review again the New York City employees PPO plan? How will it affect future retirees, and whether someone who moves outside the 13-county GHI area but can travel from nearby, let's say Albany, can continue staying with GHI coverage as opposed to United Healthcare?
If you're retired or if you're under 65, whether you're retired or still actively working, this NYSE PPO is going to apply to you. So the doctors are, it goes by where the doctors are. So if you wanted to go to a doctor, if you live in Manhattan and you want to go to a doctor in New Jersey, you would go to a doctor in the United Healthcare network. If that's what you want to do. Or if you live in Albany and you want to, it goes by where the doctor is, not where you live. That's how to look at that. I don't know. Did I answer? I'm not sure if I answered the question. It's based on where the doctor resides. So If you live in New Jersey and you want to go to a Manhattan doctor to go to someone that's in the GHI network, then you travel into Manhattan to see a GHI doctor.
And just if your spouse is over 65 and you are not, are they required to enroll in Medicare? So again, the same.
If you're still working, they do not have to. If you're retired, then they do.
Can you repeat the phases of phase retirement again? Are there 1, 2, and/or 3 years?
It can be either 1, 2, or 3. So there's 3 options. You can phase for 1 year, 2 years, or 3 years. It's on the application, and you decide how to break out your workload. Everything is there on the form.
If I plan to retire before age of 62, what type of health insurance benefits am I qualified for from? I have been working the same campus for over 25 years and I have TIAA.
If you're in TIAA, you have to, and you have over 15 years, you still have to be 62 to be eligible for retiree health.
Right. I think that's it. I think the rest we could tackle them
I'm going to stay on, and if you want to
and
proceed,
answer
I
some of
can
those.
continue. I'll answer the questions in the chat.
Okay, thank you, Talin.
Great. Thank you,
Okay.
Talin. Over to you, Michael.
Awesome. Thank you, Rico. Thank you, Talin. That was great. And thank you, Sandra, for your earlier presentation. Good morning, everyone. My name is Michael Foley. I'm the Director of Communications for the PSC CUNY Welfare Fund. Since you are either thinking of retiring or you're actively engaged in the process of retiring, just let me congratulate you on what I hope was a fulfilling CUNY career. You've obviously made a difference in a lot of people's lives, and you've earned these retirement benefits. And I wish you a happy and healthy retirement. That said, I'm going to dive in and share my screen. Okay, good, good, good. Can everyone see that? Excellent.
Yep, looks good, Michael.
Okay. All right. I want to give you the lay of the land, so to speak, of the retirees that the welfare fund serves. So how many retirees do we have in our system? That many. Our youngest retiree is 47 years old. That's most likely a disability retirement. Rico, guess how old our oldest retiree is?
I don't think I should guess, Michael.
What's that?
I don't think I should guess.
Yes, you should. Come on.
No. I think you should just tell us.
All right. 107 years old. I'm pleased to say that last year, our oldest retiree was 106. I don't know who this person is, but they successfully turned 107 recently. So that's our oldest. And retirees age 100 plus, 23. Okay, so that gives you a sense of many of you will have a long and healthy retirement. And you have, as mentioned before, you really have outstanding benefits. And I know this is a kind of a challenging process for you to think about. You've got a lot going on in your life. Many of you are still teaching right now, but we are here to help. You've been listening to some really, really knowledgeable people. Sandra is an expert in this field. Talin is an expert in this field. I can handle some many questions and whatnot. The union has done a wonderful job with organizing sessions like this. So please do not feel that you are alone in this process. There are many people here to help you and guide you through this. But it's also, the onus is on you to make sure that you meet certain deadlines, that you keep that checklist and check it off as you go forward. The worst thing you can do is put things off. It only creates problems down the road. But again, we are here to help. All right. If you are thinking of retirement, please go to our website, pscunywf.org. we have a section here called Thinking of Retiring. It lays out the entire process in writing for you to follow, including how to contact Sandra if you're a TRS person, how to set up an appointment with Sandra to go over some of the details. But this is a great place to start, and make sure that you're following the needed tasks that will help you successfully complete the retirement process. The welfare fund itself, we are an independent nonprofit. Please keep in mind, we are not part of the union. We're not part of CUNY. We're affiliated with both. So for instance, if Chancellor Felix Matos Rodriguez was on this call, let's hope he's not, he would be, if he's eligible for retirement for welfare fund benefits, he's not in the union, we would still provide him with those benefits. We serve all of the 26 campuses. We have a staff of about 12 right now, supporting 20,000 active and retired members. Now, double that number if you count their dependents. So we have a lot of folks dependent on our benefits. We're funded on a per member basis, and that's an agreement, a contractual agreement with PSC and CUNY. Our funding is limited. Our financial bottom line is healthy, but we sometimes have to make some difficult choices over things like drug coverage, some other issues and whatnot. We're always working hard. Our board of trustees is working hard. James Davis is the president of our board of trustees. We're working hard to make sure that we balance out our benefits, that we offer the best benefits to all of our 40,000 people that depend on them. So let's go over some of your in retirement welfare fund benefits. Prescription drugs. This depends if you're under 65 or over 65. If you're under 65 when you retire, your CVS Caremark prescription drug plan continues as is. If you have questions about it, please go to our website. The prescription drug formulary is always updated on our website. You can check to see if your medications are there. You'll get details on how to save money at the pharmacy counter by using generics and some other things that can be beneficial for you. If you are over 65 when you retire, you'll be moved into what's called the the CVS SilverScript plan. That is a Medicare Part D based drug plan. It's somewhat similar. The formulary is different. Again, check that formulary on our website under the prescription drug section of the website, and just double check that the medications you may take now will be covered under SilverScript. Chances are they are. If they are not, give us a call. We'll connect you with one of our prescription drug experts and go over ways to make sure that you get the medications you need in retirement. The PICA program, which you may be familiar with right now, that's a City of New York benefit. It's managed by Express Scripts. You may have that card, PICA Express Scripts card. That offers active employees access to injectable medications and chemo drugs. That goes away in retirement because a Medicare Part D plan, such as SilverScript, picks up a lot of those medications. Once you enroll in Medicare, diabetic drugs come from here at the Welfare Fund. As an active employee, diabetic drugs come from your city medical benefit. That changes in retirement. So the bottom line is you continue to get the same kinds of drugs, but in some cases, they're coming from different entities once you retire. Again, this has already been gone over a little bit, but I just want to emphasize prescription drugs. When you retire, sign up for Part A prior to retirement. Sign up for Part B as you become retired. Please do not sign up for a Part D drug plan. As Talin referenced earlier, you're going to get a lot of communication in the mail, emails, phone calls. You're going to see late night TV ads. You're going to see a reference to Part D drug plans. Do not buy any Part D drug plan. You get your drug plan through us. It is a Part D drug plan, but it's called CVS SilverScript. You do not need to pay out any money for any kind of drug plan. If you're confused in any way, if you have any questions, call us and we'll straighten that out for you. Okay, as I mentioned, most of the welfare fund benefits do not change upon retirement. If you're in the Guardian plan now, you're in the Guardian plan in retirement. If you're in the Delta Dental plan now, you're in the Delta plan in retirement. If you are enrolled in the Davis Vision benefit and you use it, you'll continue to use it in retirement. Same with hearing aids through True Hearing. Um, I have some big news actually for everyone. Brooklyn College has had a audiology clinic for decades on the campus. I believe it's doctorate students staff it at times and whatnot. The Brooklyn College Audiology Clinic is now an official True Hearing provider. So now or in retirement, if you need a hearing exam or if you need devices, get on the 5 train, go out to Flatbush, and get that care at Brooklyn College. That way you're sort of keeping it in the family, so to speak. Some welfare fund benefits end at retirement. Your basic disability, and if you signed up for the extended disability, that ends because you're no longer an active employee. The $5,000 death benefit for employee survivors, that goes away. Now, the extended medical benefit. This is the one area where the welfare fund sort of collaborates with the city on the medical benefit plan. Um, the extended medical benefit through the welfare fund offers you an extra layer of protection if you run into some out-of-pocket medical costs that aren't paid by the GHI CBP program. Now, enrollment in the extended medical benefit is predicated on being in the GHI program, which is going away, soon to be replaced by the NICE PPO plan. We are trying to figure out right now what is going to happen with the folks that are enrolled in the extended medical benefit. What we have we've learned a lot recently is that a lot of active employees use the extended medical benefit plan to pay for therapy, mental health therapy, things like that. A lot of therapists just don't even take insurance, but this is a workaround. In retirement, you may be eligible for certain mental health care through Medicare and things like that, but stay tuned on what happens if you're an active employee. Stay tuned to learn more about what happens after January 1st when NICE PPO kicks in. Let me touch on survivor benefits, by the way. This was mentioned earlier. If you, as the CUNY retiree, if you've got a dependent, if you pass away, that dependent is eligible to buy the welfare fund's benefits. So they can purchase the prescription drug, dental, hearing, and vision benefits, even though their spouse, who is the retired CUNY employee, if they have passed away. That person can call us, the survivor can call us and set up the arrangement to buy our benefits, which are otherwise provided at no cost. The cost right now is over $3,000 right now to buy those benefits, prescription drug, dental, hearing, and vision. That is a very good deal compared to getting those benefits on the open market. So you might want to keep a file of some of these details to give to family members or let family members know where the file is for these kinds of key details. So in other words, if you are the CUNY retiree, write down that if I pass, my spouse is eligible to purchase the welfare fund benefits, have a phone number there. That way, the spouse or a family member won't have to make a lot of phone calls and search around or not realize that they're entitled to these to purchase our benefits. Catastrophic major medical policy, long-term care, life insurance. Hopefully, many of you on this call purchased a catastrophic major medical policy through the welfare fund and or a long-term care policy through the welfare fund. It may have been decades ago. You may have been paying premiums for these policies for many, many years. It's essential that you continue to pay these premiums after you retire. Right now, when you're active, you may have set up automatic deduction from your paycheck or from your bank account, or you may be paying them directly yourself with a credit card. Keep in mind, one more thing to add to the retirement checklist is to make sure that you have a method to continue paying these premiums. You've been paying these premiums all these years. I don't want you to lose these policies because you cannot get these policies on the open market at any affordable way, except for going through NYSUT a little bit, and we'll talk about that later. But we've been unable to offer a catastrophic policy and a long-term care policy for well over 10 years because we cannot find a life insurance or an insurance company to underwrite these policies at anywhere close to an affordable premium. So please protect these policies. And regarding your catastrophic major medical policy, don't think of it as only for catastrophes. I would much rather refer to this as an everyday major medical policy. There are great benefits in this policy beyond simply in-home care and things like that. Any out-of-pocket cost or nearly, you'd be surprised. A lot of your out-of-pocket costs can be paid through your catastrophic major medical policy. So if you've got questions about a catastrophic policy or a long-term care policy, please call me. There are, you can still buy these on the open market. NYSUT still offers a long-term care policy and on occasion a catastrophic major medical policy. So you're not completely shut out of the market, but the market is much more expensive now compared to when we offered these plans. And it's a good idea to set up automatic deduction again in retirement if you want to. You can do it through your pension system. You can contact TRS or TIAA and have that premium payment deducted from your pension, or set it up through automatic deduction from your bank account or whatnot. It's really just a matter of deciding what your preference is. If you're used to automatic deduction, I'd say continue it during retirement. Again, protect these policies. They are so essential. And going into an assisted living facility without insurance will destroy your finances, can really basically eliminate your estate. So do what you can to either to both protect these policies if you have them, or look around for options to buy them. Our website has literally everything I've just discussed, along with both the page that I mentioned, Thinking of Retirement, as well as a page called When You Are Retired. So please bookmark this website. Go to it frequently if you need to. All of our contact information is on this website. Call us. We are here to pick up the phone. We are here to answer emails. Again, let me emphasize, you're not alone in this process. Numerous people can assist you. So you have support. So I urge you to sort of become actively engaged with your retirement process, but we have people here to help. Any other things I haven't touched on? I think that's about it. Gonna stop sharing. How are we doing on questions?
There's a couple, so I'll ask you.
Hit me.
The first question is, didn't they just switch prescriptions to Amazon?
So that's in the NICE PPO plan. That's an excellent question. I want to address this. There have always been, and there always will be, some medications that the city of New York provides through the medical benefit plan. That is primarily diabetic medication. The PICA program covers injectables and chemo, and there are some Affordable Care Act mandated preventative medications like statins or whatnot that are paid by the city. That will, for active employees after January 1st, all of that will generally become covered through the NICE PPO plan. In other words, the medications covered by the city right now will continue to be covered under the NICE PPO plan. If you're imminently retired, if you're going to be retired like now or shortly after January 1st, you can kind of like disregard the fact that is happening, because those medications provided by the city, that becomes generally picked up by the CVS SilverScript policy.
Which it's a good segue for the next question.
Yes.
Will other maintenance drugs that are now coming from our health plan also start to come from SilverScripts once we're retired?
Yes, absolutely. So, all those good maintenance medications picked up by SilverScript. And, frankly, I hope everyone is healthy out there and whatnot. And if you haven't used your benefits, take advantage of those preventative benefits that are available. Get an eye exam at no cost. Use those 3 free cleanings, dental cleanings, and exam and X-rays as needed. And that way, your future self will thank you. You'll do some preventative work, prevent issues from coming up down the road. So get a vision exam at no cost. So utilize some of those benefits right now. You'll get in the habit of using our benefits now and in retirement. And the best way to do that is utilize those preventative benefits.
If I'm not eligible for CUNY healthcare plan when I retire, can I still keep my vision, dental, hearing aid? And if not, how can I pay to keep it? I will not be yet eligible for Medicare.
Sandra, what
They're
do
not
you think?
eligible for health and welfare fund benefits when they retire.
Right.
So the answer is no.
Yeah. So in other words, upon retirement, if you're not in the GHI senior care plan,
Yeah, they're
right?
not
Yeah.
meeting the criteria to retire with benefits.
Right. Okay.
So the answer is no. What is the extended medical benefit plan?
The extended medical benefit plan is a kind of a deductible based plan where you purchase a additional layer of medical benefits provided. In other words, doctor, hospital things. So most people that opt for the extended medical benefit, there's not a lot. But what they usually, there's something happening in their life, some medical condition, therapeutic care, like mental health care, things like that, that utilizing the extended medical benefit plan helps them pay those costs. But like I said, there's not a lot of our members utilize the benefit, but we're trying to figure out a way to make this benefit coexist with the NICE PPO plan when it arrives.
There's a question here about the hearing test. Is there any extra benefit to going to, I guess this stands for Brooklyn College hearing test, or can I go
No,
anywhere?
I mean, only because, they're awesome people at Brooklyn College. True Hearing is a great benefit provider. They have offices all over the country, the 5 boroughs. You won't have any difficulty finding a True Hearing office and going in for an exam. But if you're anywhere near Brooklyn College, utilize it. It's great. You probably run into some colleagues or some people or something along those lines. But True Hearing is a great benefit. They're everywhere. And on our website, we have a special phone number for True Hearing PSC CUNY folks that are in the True Hearing plan to call. You'll get right through to someone. They'll understand that you're from the PSC CUNY Welfare Fund, and you're entitled to a specific set of benefits.
What are the 3 free dental cleanings?
So if you're in the Guardian plan, you have 3 free cleanings per year, along with X-rays as needed. If you're in Delta, I believe it's 2. So you utilize those preventative benefits. That's a key one. If you can just get that, your maintenance dental care taken care of, you won't run into issues down the road, hopefully. So.
I'm active member and has Guardian dental plan. Can I change to Delta plan? How can I go about it?
You can. During open enrollment, you can. Open enrollment still has about a couple weeks left. So if you want to do that, that's fine. You can go to our website, and we have on our website the so-called fee schedule for both plans. You can compare and contrast. The challenge with switching to the Delta dental plan is it's an HMO, so it's a little more difficult to find a dentist that takes Delta. It's much easier to find a dentist who takes the Guardian plan. And the other challenge is finding a dentist, any dentist that's accepting new patients. So if you're up to the task and you want to compare them side by side and decide which one is better or whatnot, you can go ahead and make that change during open enrollment.
Right. Is the yearly vision plan the same as before retirement?
It is. So our vision benefit through Davis Vision is great. It's a once per calendar year benefit. So you can get a free exam. And if you select from a group of frames, I think it's about 25 to 30 frames, you can go to a Davis Vision office, get that exam, get a free pair of frames and lenses. And if you haven't used that benefit in 2025, for instance, you could use it now and then go back on January 1st and use it again. So, take advantage of these benefits. And at the very least, just get the eye exam. We eliminated the so-called split services rule a little while ago that required you to get an exam and frames and lenses at the same time. That's gone. So you can just go in for the exam and then decide what you want to do. Keep in mind, if you have a optometrist office that you like that's not in the Davis Vision Network, you're eligible for a $200 reimbursement.
Right. So talking about in-network, out-of-network, there's a question here. Two questions. One says, is the dental cleaning free or is there a copay? And then the other question is, I go to participating dentist in-network and they charge me for cleaning.
Where the dental plans can break down is at the office itself. Oftentimes, your dentist office doesn't understand or doesn't realize what Guardian plan you're in. So when you're at the dentist, before you get in the chair, tell them that you're a PSC CUNY Welfare Fund member enrolled in the Guardian Dental Plan and have them call Guardian Dental. And you should always be a little aggressive at the dentist office before they try and upsell you on some product or tell you you need some procedure. Use 3 words. Is this covered? Be aggressive, because I've spoken to too many members. If any of you and I have bumped into each other during the recent benefit fairs, we probably talked about this. Be aggressive, particularly with your dentist office. What I've noticed is that a lot of the dentist office are not fully knowledgeable about the Guardian Dental Plan. If you feel you're being upsold, if you feel you're being treated unethically or charged in some way that doesn't sound right to you, stop the process, have the office call Guardian, or have the office call us.
As an active employee over 65, how do I find out if I have access to long-term care from MetLife?
From MetLife. So as mentioned, NYSUT, New York State United Teachers, if you're in the PSC union, you're most likely a member of NYSUT. NYSUT always offers a long-term care policy. Is Michelle presenting?
Yes, and
Michelle's presenting, right?
Michelle will be presenting right after.
Yeah.
Okay.
Don't listen
She's
to me.
answering.
Yeah, I was just going to say, don't answer this.
Don't listen to me.
Okay.
Compared to Michelle, I'm remedial. Yeah.
Michelle's coming right after you, Michael. Is there a reimbursement for hearing aids if you do not use True Hearing?
Yes, let's talk about hearing aids a little bit. So the hearing benefit is very good. We switched to True Hearing a few years ago because they offered top-of-the-line devices at no cost. So the benefit is $1,500 per ear, so $3,000 in total to get basically top-of-the-line hearing aids. Now, we all know that you can walk into a Costco and buy hearing aids right now. Those are considered over-the-counter hearing aids. You are not eligible for the $500 reimbursement if you're buying over-the-counter hearing aids, which are essentially amplifiers. So before you make any decision about purchasing hearing aids, at least examine what True Hearing offers you. At the very least, get that hearing exam from True Hearing and then make a decision. So I know it's tempting when you walk into a Costco. I think Walmart even now sells hearing aids technically now. If you do not have non-prescription hearing devices are not eligible for the $500 reimbursement. Prescription hearing devices purchased outside of the True Hearing Network, you are eligible for a $500 reimbursement. But we all know how expensive hearing aids are. So my advice is simply look at what True Hearing offers you and then make your decision.
There's one more that I think you could answer when you log in to the Q&A, Mike, because it's a little extensive, and then we could just open the floor to Michelle, I think.
Okay.
Yeah,
Thank
actually,
you,
Mike,
again.
one more question, actually,
Yeah.
from Jane. What about benefits we now pay for extra in open parentheses legal plan? Can these continue in retirement?
If you have a legal plan, that's more than likely through NYSUT, and Michelle will be more than willing to discuss that. Yeah.
Fantastic. Awesome. Thank you, Mike. And
thanks, everybody. Really appreciate everyone's time. Best of luck in retirement. I hope you have a wonderful time and have great things planned.
Awesome. Thank you, Mike. And Michelle, I will spotlight you.
Awesome.
Awesome. You are good to go.
Okay, hi everyone. I know it's confusing that it doesn't say NYSUT in the background because I'm a NYSUT employee, but this is my union. So like you guys are members of PSC CUNY, my union is PSA. So today's actually our union day, and I'm not there because I have so many meetings today. Okay. All right. Here we go. All right. Let me just do a slideshow from beginning. Okay, take a deep breath. I love going right after Michael because there's so many questions that you were asking that I'm addressing in this presentation. So I would not be offended if you grabbed your cell phone and took a screenshot of any of the slides. I usually don't email my presentations because they take up a ton of like space in your emails and my emails, and you know, it's hard to go back, but I would not be offended if you took a screenshot of things. So if you need me to go back and forth, I can do that at the end of the presentation so you can get your screenshots. And I'll answer the questions in the chat at the end because I get very distracted and I'll lose my my pace. So you definitely want to take a screenshot of this phone number. It's not my phone number. This is the 800 number to NYSUT member benefit. So if you have questions about how do I join the legal plan, how do I maintain the legal plan in retirement, I will cover kind of that today. But if you're not retiring tomorrow, you're retiring 6 months, 8 months, 9 months, definitely have this phone number so you can ask those questions again. So hopefully you learn a little today, but now you have the tools to find out the information when you're ready to handle it yourself. If you take a look at this presentation, there is a blue banner at the top, and our website is in the corner. So you could always go to our website for information, but it's really hard to navigate another organization's website. So if you get frustrated finding information, stop, pick up the phone and call the 800 number and they will help you. So our agenda today is these 3 items. We're going to go through, oh, sorry, the doorbell is ringing. My program participation, there was a lot of questions of like, I'm currently paying for something in my payroll. How do I find out about that? This is a way that you can do that yourself. The transition between payroll and pension deduction, that was a lot of questions. And then just some other information on how you stay connected to us. And I will add these links in a presentation that I could email and then they can send out. My program participation is a way for you to log in with your NYSUT ID number. Everyone here as a dues paying member to PSC CUNY is a NYSUT member automatically. And you all have 7-digit ID numbers. I'll give you information on how to get a membership card and how to get that ID number at the end of this presentation. But once you have that ID number, you can click on this link and you could check to see what's currently coming out of your payroll. Because if you are one of our members who are paying for auto insurance, life insurance, and catastrophic, it will be one line item on your payroll currently. It will say NYSUT member benefits. So there won't be 3 line items. It'll just be one. So if you want to know what those details are, you could call us. We can let you know. We send you something in the mail twice a year, which usually gets thrown away. But this you can check at any time. But again, you will need your ID number to see all of that information. So this is just really good to have, just to kind of have an idea of what you're paying for your auto insurance compared to your term life insurance. So as you heard Michael Foley saying earlier, most of our members who have payroll deduction want pension deduction, but it's a completely separate entity, right? So, you know, CUNY is not paying your pension that is coming through the pension system. So it's a whole transition. We have members all the time say, well, of course I want pension deduction, and they think it's automatic. It is not automatic. I have a link here that I can also provide on the process. Michael kind of told you that earlier. Essentially, we just need to know your retirement date. Your mailing addresses have to be up to date. So if you're moving the day you retire, we need to know that NYSUT member benefits, and so does the vendor of the insurance, because you won't be having a vehicle for them to do the payroll deduction because you're stopped getting paychecks. So they have to send you a direct bill. So that is why it's so important to have your mailing address up to date with us and the insurance vendor. So this checklist here from the transition from payroll to pension deduction will list all of that. So the most important thing is your mailing address. You pay that first bill. And then once you start actually getting your pension, which is a monthly pension, or if you have an annuity with TIAA, you can transition into the pension deduction, and it's the ease of it. It's coming out every month, and you continue to receive the discount associated with payroll deduction. Also continues for pension deduction. So if you have life insurance, you get a 10% reduction in your policy. So we don't want you to lose that doing the direct bill. So remember, there is a transition. It is not automatic. So keep that in mind. And if 6 months after you retire, you realize it's not coming out of your pension, call us. That's why I gave you our phone number. We'll make sure that you don't lapse in your policy. If that happens, you will get notices. You will always get notices. They won't drop you on the first miss of a payment. So if it's within 6 months and for some reason your policy lapsed because this transition didn't work, we can work on getting you reinstated. If it's 5 years down the road, unlikely. So, you know, if it's within a reasonable period of time, we can assist with this. So it's a lot of information to digest, I know. And again, you know, I just said that's not automatic. Maybe I got ahead of myself. I'm just going to skip this slide. So the other question we always get is, I'm a NYSUT member because I'm paying dues to PSC CUNY. How does that work in retirement? Well, NYSUT does not collect retiree dues. However, PSC CUNY has a retiree chapter in their membership department, and they collect dues. So if you don't currently, when you retire, if you don't continue to pay retiree dues to PSC CUNY, you will not be a NYSUT member. And if you're not a NYSUT member, you can't keep, say, your insurances that you are currently paying for. So that is a must. So definitely take a screenshot of this. I don't know if membership is presenting at all today. I should have memorized the agenda.
Yeah, Michelle, after you will be Bonnie Nelson from
Oh my
the
gosh, that's why
retiree
it's so
chapter.
perfect. It's like Michael, me, and then Bonnie. So it
Yep.
is extremely important. What typically happens to our retirees is they'll get a letter from the insurance vendor saying you're not a member. They call NYSUT, and NYSUT can't fix your membership. That comes electronically from PSC membership. So keep in mind that there's a retiree chapter, and you'll find out more about that after me. And so the common question, we already have this in the chat, was how does my spouse, who is not a CUNY member, PSC CUNY member, keep these insurances if I pass? There is an option for them to join as an associate member with NYSUT. They'll be able to keep the auto insurance, the car insurance, join the legal plan. However, the one exception is your surviving spouse cannot join as an associate member to keep the catastrophic. That's asterisk down at the bottom. It says excluded is the CMM. That's the catastrophic major medical. Unfortunately, your surviving spouse cannot join as an associate member. They would only be offered COBRA for 36 months, like a typical health insurance. So that is the one exception. Your surviving spouse cannot join as an associate member if you do not have any of our programs. So say you pass as the member and your surviving spouse is like, well, now I want life insurance, or, you know, if they can apply based on age, or I want to join the legal plan. They can't do that. Just the vehicle is there for them to keep something, so they can't join it afterwards. So just keep that in mind. We are also affiliated with NEA, which is the National Education Association, and AFT, American Federation of Teachers. national unions. We're the state union, and PSC CUNY is your local union. And so NEA, a lot of our members, they do a really great job with their marketing. They also have a member benefits department just like us. So some of our PSC CUNY members actually have their life insurance with NEA and not NYSUT, which can be kind of confusing. And they have a lifetime membership, and our members get confused because they do know that they have to continue to maintain their membership to have like our insurance. But you do not need to join this lifetime insurance to keep, say, your life insurance with NEA. That's really just for voting rights. So that's a very common question I get. I think a lot of our PSC CUNY members are split between having their life insurance with us and NEA. So just also, there's so many layers, and I'm trying to connect the dots to all of these. We have a newsletter that you can sign up for. We have over 40 programs. I'm talking just a little bit about the insurances because if you lapse in a payment of an insurance, you would lose your policy, and we don't want you to lose like your car insurance if you're retired. But we also have a legal service plan, a financial counseling program, a mortgage endorsement. We have shopping and travel discounts. We have over 40 programs. And as a retiree, it's hard to kind of keep up with everything. So if you sign up for our newsletter, once you go to our website, it usually is the first thing that pops up. It's like, join our newsletter. You'll receive up-to-date information on new programs, changes to the program. So it's kind of good to be a part of this because, you know, direct mail is where you're actually printing out information and mailing it to membership. It's just getting so expensive. We have 600,000 members. So when there's a change to one of our programs, we don't necessarily always send out a mass mailing for it. But this electronic newsletter is good to have. Like I just said, we have over 40 programs. The most popular programs, PSC CUNY members are using us, the term life insurance, the catastrophic major medical. I do want to stop on catastrophic major medical. I could do an entire presentation on this. We could talk about doing a presentation for those who have this insurance at another time, because I could do a whole hour explaining what this is. Catastrophic major medical is the one program that you can only join during an open enrollment. All the other programs you can do at any time. It doesn't tie into your open enrollment. But the open enrollment for catastrophic major medical is our open enrollment with NYSUT member benefits, not your HR department. The last open enrollment for this was in 2022. I do not know when the next one is going to be, probably soon. And you can only enroll in this catastrophic major medical insurance if you are in service. So unfortunately, if you retire by the time the next one rolls around, you would be excluded for it. So don't come at me. That's just the rules and the regulations. So hopefully if there's an open enrollment, you're still in service. And if that's something you want to get, catastrophic major medical insurance is confusing because it has multifaceted benefits. It's a supplement to out-of-pocket expenses. There's a critical illness rider. There's long-term care type benefits, nursing home, home healthcare aid. So that's why I can do a whole presentation on that for an hour. We actually do have long-term care insurance. MetLife used to be our sole underwriter, but now we use a brokerage. So if you want to apply for long-term care insurance today and forward, it may not be with MetLife, but a majority of our members do have MetLife while they were still in the business. Our auto insurance is always very popular. And this is definitely something when you retire, you're on a fixed income, make sure you're paying what you're paying. So get a quote. The legal plan, absolutely a fantastic program, $85 to join. You have it for the year. You get all your legal documents for $85. Your will, living will, healthcare proxy, power of attorney. Make sure those things are in place. You know, as we're getting older, we want to make sure that we definitely have our power of attorney up to date, because if anything happens, that's designed for somebody to make financial and even medical decisions for you. So great program to use. I feel like it's underutilized. And you have access to this in retirement, because remember, you remain a retiree, a NYSUT member in retirement as long as you are part of the chapter. We have a peer support line. So if there's a lot of questions about like Medicare and tying all these things in, our peer support line can assist with that. They're not specialists in Medicare. They're actually peers, NYSUT members. But they're there to take phone calls and questions for all things kind of social service, and it might be a great resource for you. to kind of connect and connect all the dots. We have access to a free call map and a deals and discounts. So definitely visit our website, call us for more information. This is just, like a few of the programs that we have to offer and that you can use in service and as a retiree. Remember I said you can't access a lot of our information until you have your 7-digit NYSUT ID number. We used to send, membership department, which is a separate department from ours, they used to send out membership cards. We are no longer sending out membership cards, completely digital. And it's really cool. You can download it and it will live in your Apple or Google Wallet if you have an Android. And it's a NYSUT membership card with your 7-digit NYSUT ID number. So I have a hyperlink. I can stay on this call while the next presentation is going on to answer all the questions and make sure you get all the links. But definitely download your membership card. So if you're overwhelmed, these are just like 2 tasks that you can do after today. Make sure you download that digital membership card and create a cell phone contact for NYSUT member benefits and PSC membership in your cell phone, because those are the contacts that you're going to need moving forward. So if you do anything today, those, I guess, technically 3 things, because it's 2 contacts in your cell phone. So this is where I do have to give a disclaimer, because when I do these presentations, I'm not a lawyer. I'm not a financial advisor. I can't give any legal or financial tax information. And I'm also not licensed to sell any of these insurances. So I can only give information on a broad level. So you can't come back at me and say, Michelle said this, and it's incorrect information on the specifics of one of our insurances, because it's really, you should be speaking with the insurance advisor. So that's my disclaimer. So you can't come back at me. So the questions, I'm going to leave this to, I'm going to answer them in the chat, and this is our phone number. Definitely take a screenshot of this. And I am going, how do you want to address the questions? Do you want me to go into them, or do you want to ask
Hi,
them, Sandra?
Michelle. I'll ask you.
Okay, thank you. You're so sweet.
So the first one is, does NYSUT offer auto and home insurance programs in New Mexico where we will be retiring?
In New Mexico. I actually don't believe it's out of the continental US, but I would call the 800 number and ask for specifics. So
What is the legal plan?
the legal plan, I sort of briefly spoke about it. Again, it's $85 to join. You have it for the year. And people are joining the legal plan to get their legal documents, the will, living will, healthcare proxy, and power of attorney. So the legal plan is really just a vehicle for you to get those documents. But while you have it, you have access to calling the law firm, which is Feldman, Kramer, Monaco, and asking some legal advice. If you need to retain a lawyer for legal representation on a personal matter, it won't be $85, but you get discounted fees. And while you have the legal plan, you have discounted fees on home closings, divorces, anything that is a personal legal matter, the legal plan can assist with.
Okay. There are 3 separate questions asking when you will be doing a webinar about catastrophic major medical.
Well, I've never done one for PSC, so that would have to be something that maybe Michael Foley and I would work on.
Okay.
Yeah,
But I do
Michelle.
them a lot for the welfare fund for UFT. But
So maybe after this, Michelle, Michael, and I will touch base and we'll get something scheduled maybe for the early spring or something.
yeah, because I think a lot of your membership have our catastrophic, and it's always good to really just review it. But it's a lot of content.
Right.
We'll get that scheduled and send that out to folks.
Awesome.
Right as well.
And then Rico, there's one about the slides from Michelle, providing the slides before the meeting. Can you send a copy of the slides after the meeting? So
I know I tend not to send it, but I will forward it, just because our information changes so rapidly. So, I do have the disclaimer on there, and then I will say, last updated what the date is.
Great. So Michelle, if you could send that to me, I'll include that in the folder that we share.
Do you want it as a PDF?
Yes, please. Thank you.
the other question, how do I download the digital ID number?
The link will be in this presentation when I send it.
Okay.
All good questions.
How do I get the NYSUT ID number?
You can call the 800 number that's on the screen right now. 9 to 5, Monday through Friday, and they'll be able to look you up. My colleagues that answer the phones, you'll actually speak with a person. We'll look you up in the system and give you your ID number.
Okay,
And they can
someone
even
is
talk you
asking.
through how to download a membership card if you need to.
Okay, and someone is asking for the 800 number. I'm putting it on the Q&A I did before, and I'm putting it again.
Yep, and it's right there. The 800 number is right there on our website on the screenshot.
And how often is the open enrollment for the long-term care insurance? I will be active for 2 more years, then retire. Do you think the next open enrollment will happen within the next 2 years?
Okay, so I'm going to answer that kind of 2 ways. Long-term care insurance is something that you can apply for at any time. The catastrophic major medical insurance, which has some benefits that are like long-term care insurance, that's the one, the open enrollment was in 2022. And, I beg and plead with my colleagues to give me any sort of information. I would say they aren't giving it to me, so I do not know, and I have no indication, but it's been every 3-4 years, I believe. So unfortunately, and how we communicate that again won't be via paper. What we do is we during an open enrollment, we'll work with the PSC CUNY Welfare Fund, and they will send out emails about the open enrollment, and I will do webinars where you can get more information. So the first way you would find out about an open enrollment is probably on our website, be signed up for a newsletter, or through the Welfare Fund forwarding out an information about the open enrollment.
Okay, that was the last question, Michelle.
Awesome.
Thank you, Michelle. Really
Yep.
appreciate it. And again, folks, Michelle will send over those slides to me, and I'll include that in the folder that I send out to everyone early next week. So thanks again, Michelle. Next, Bonnie, are you ready? I'm gonna go ahead and spotlight you.
Yep. Yep, I'm ready.
Okay, awesome. You are good to go.
Okay. So I know I'm the last speaker and everybody's tired and you want to go get something to eat. So I'll try and keep this brief. I've been looking at the Q&A and I can see that this has been very confusing to a lot of you, even bewildering. So let me second what Talin said earlier. You should attend multiple pre-retirement conferences. I attended at least 3 before I retired, and it was still confusing when I retired. But everybody gets through it, so it's going to work out. Don't worry. I'm the secretary of the retirees chapter, and I'm here to tell you why you should join our chapter after you retire. I was originally going to give you the same spiel we've been giving for ages about why you should want to join, to keep in touch with colleagues, monthly meetings, et cetera, et cetera. But I'm really here to tell you why you need to join the retirees chapter. And it's not just so that you can keep your NYSUT benefits. But all those great benefits you've been hearing about, the medical benefits from the city and all, there are people out there who want to who want to take them away. And you have to be prepared to fight for them. Many of you probably know about the big battle over New York City trying to move Medicare-eligible retirees from traditional Medicare into a Medicare Advantage plan. That battle went on from 2021 through this past June, when Eric Adams finally threw in the towel. I won't go into all the details, but the PSC, led by the retirees chapter, was in the thick of the fight. But only PSC retirees who were chapter members were fully informed about what was going on and able to contribute to the battle. We turned out for demonstrations, we wrote letters, we made phone calls. Just as important, or maybe more so, when it looked like our retirees would be faced with the ugly choice of either joining a subpar Medicare Advantage plan or losing New York City funded health insurance altogether. And you just learned what a good deal that is, and it is a great deal. A team from the PSC organized to help retirees make that decision by putting together information sheets, FAQs, charts showing the financial implications, etc., and holding information sessions with our own experts. A lot of us, including me, spend a lot of time, holding people's hands and trying to guide them through this process. Fortunately, we didn't have to do it. But if you were not a member of the chapter, you probably didn't know about any of this. You just, got information. You got whatever information the city sent out or you were able to read in the news. So we inform our members about what is going on via email blasts that we send out 2 or 3 times a month. In these emails, we talk about upcoming chapter meetings and other events, as well as PSC activities, especially as they affect retirees. But we also try to remind people when they have to take action to claim their benefits. You learned this morning that New York City will reimburse you for your Medicare Part B premiums, including any additional payments you might be making if your income is relatively high. Those are the IRMA payments. In our emails, we try to remind people when they can expect their standard Part B reimbursements from the city, and when they need to file the forms to claim the IRMA reimbursement if they have higher incomes, because they have to file this form every year, but you may not remember. You have to do it. You may not know when the form is available to be filed. So we tell you these things in our email blast. Yesterday at 10 in the morning, we sent an email blast reminding people that they should have received their IRMA reimbursement last month. By 4:30, a dozen people had emailed us asking what to do if they didn't get the money. We try to look after our members, but if you don't join, we can't help you. A reminder, although if you are faculty, you can keep your CUNY email address after you retire. Most people no longer use their CUNY email much after a few months. Now is the time to make sure that the PSC has your personal non-CUNY email address. If they don't, you should contact us, and I'm going to give you, I'm going to screen share the addresses where you can reach us. Okay, so you can provide your personal email. You can send email to jverone@pscmail.org, or you can go to tinyurl.com, PSC member form. And then you'll be able to give us your personal email account, and you can stay in touch with the union and we can stay in touch with you. Of course, there are other things you should know about the retirees chapter. We're a full-fledged chapter of the PSC with close to 3,000 members. We have our own executive committee of 27. We have 2 representatives on the Central PSC Executive Council. We have 7 delegates and 5 alternates to the Delegate Assembly. Our members are also delegates to NYSUT and AFT. We vote in union elections, both for university-wide officers and for our own chapter officers. Also, our monthly chapter meetings are pretty great. Last month, we had a fascinating presentation on artificial intelligence in war and in higher education. And coming up on December 1st will be the second part of an in-depth discussion about different living arrangements for people as they get older, when staying in their current house or apartment may no longer be viable. These meetings are held via Zoom the first Monday of most months, and they are recorded. So if you miss them, you can watch them afterwards. We also put out an online newsletter every other month with in-depth articles and reports written by and about our members. These are all linked to from the retirees webpage, and I'm going to share that webpage with you now so you can see some of what's going on. So these are the things that are, this is our retiree webpage. You can see upcoming chapter events. We have a film screening coming up next week, and our next chapter meeting is December 1st. They're always on a Monday, and that's about residential living and care arrangements for seniors. And you can easily see past chapter events and recordings of them anytime you want. So if you want to get a preview of what retirement has in store for you and the retirees chapter has in store, you can take a look at these. And that's off the PSC site, just /retirees. Okay. What else did I want to tell you? Okay, we participate in a number of PSC committees and working groups, such as the Social Safety Net Working Group and the Environmental Justice Working Group. The Retirees Chapter was also instrumental in reinvigorating the PSC Pension Committee. And the Pension Committee is working to improve the information available to you that explains the retirement systems, both TRS and TIA. I know there's a lot of confusion about how retiring with TIA actually works, and hopefully we'll have some simple documents available for you in the near future. I'm not sure if it's going to be available in time to be included in the packet that's going to be mailed to you. But one last thing that might have gone by quickly about travel leave, which I want to point out to library faculty or HEOs that might be attending, because I'm a retired librarian. So library faculty, HEOs, and others who accrue annual leave and sick leave on a recurring basis, you'll only get the full equivalent of the full semester equivalent of travel leave, which is 5 months, if you are at your maximum travel leave of 100, your maximum sick leave of 160 days. If you fall 1 day short of that, you only get half of that accrued time, which is so no more than 79 days, which is closer to 4 months than 5 months. So if you're nearing retirement and you get sick, take your annual leave. Don't take a sick day because you don't want to fall below that maximum in the sick leave bank. So that's just a little tip that was passed on to me at a pre-retirement conference, and I thought I would pass it on. Beyond that, I want to say that most of us think that retirement is great. Once you're past the hassle of filling out all the paperwork and dotting all the I's and crossing the T's, it's a blast. You know, it can be traumatic at the beginning, but the freedom is amazing. You can do whatever you like, whenever you like, within reason, of course. So I want to wish all of you good luck, and I'm looking forward to seeing you at our chapter meetings. And if you have any questions, I'm happy to answer them.
No more open questions, but Larry did want to tell you, Bonnie, that it's great to see you.
Okay, nice to see you.
Okay, let's see.
Now they're coming in, the questions.
Yes, now the questions are coming in. Kenneth, I'll put as this is the question for Bonnie. Can you repeat what you said about keeping our CUNY email address?
Yes, if you're a faculty member, then according to the contract and according to Board of Trustees resolutions, you are entitled to keep your current PSC, I'm sorry, your current CUNY email address for life. And when you retire, there's a form that you should be given that will say, that asks you, do you want to keep it? And you say yes, and then it's up to your HR department and your IT department to make sure you get to keep that address. If you're a HEO, if you're non-faculty, a HEO or a CLT, you don't have that ability to keep it. You can get a different CUNY email address. It's a CUNY retiree email address, but you don't get to keep the original one. And that is very confusing to a lot of people, but there is a form. You should get it on upon retirement. Most of the HR departments know about it, so you know it should work out.
Great. And a couple questions about if adjunct faculty are eligible to keep CUNY email address.
I don't believe so, but I'm not sure about that. That's a good question.
Yeah, I don't believe so either. I think it's full-time faculty. A question from Eleanor: how to apply for emeritus professor at one's campus or the graduate center?
If you're a full professor, it should be automatic. If you're less than a full professor, associate, or assistant, I think then on your campus there should be a way to apply through the personnel process. I believe it might be different on each campus.
Yeah, I believe it's college specific. CLIP instructors are considered full-time instructors. Do you know if CLIP instructors can keep their CUNY email?
I've never come across that question. I don't see why not, but I'm not positive about that.
Yeah, Carol, I don't know the answer to that question. I'll record this and try to get back to you.
There's a question about keeping your library privileges. There's been something in the PSC contract for many, many years that you get to have access to the libraries, and generally you can take out books. Beyond that, it's very fuzzy and might, you know, what privileges you have, whether you have interlibrary loan. Most campuses, I think, do extend that courtesy to retirees, but it might depend on the campus.
And then I think the last question is from Jean. What if you're actively teaching as an adjunct but retired from full-time HEO? Again, I think because HEOs nor adjuncts are entitled to keeping their CUNY email, I don't think that applies in that situation. Okay, I think that's it. Thank you, Bonnie, for your time. And with that, I will take you off the spotlight and bring back Felicia to close this out.
Thank you, Rico. I would like to thank our panelists today who presented at our pre-retirement conference. Thank you all for taking time out of your busy schedules to attend. And also thank you all to the members who attended this conference. I know you have a busy schedule. I do trust that today's session provided you with valuable information that is practical as you embark on your retirement journey. Thank you once again, and I wish you all a wonderful day. And if you are embarking on retirement, happy retirement. I am not close to retirement as yet, but I sit in these conferences and they are very educational. So I should be a pro when I'm ready to retire. So thank you, everyone, and have a great day.